What is a mammogram? A mammogram is a test that looks for changes in the breast, including changes caused by breast cancer. Mammograms use X-rays to see breast cancer before you even notice any sign that there might be a problem. If the mammogram shows that there is cancer, then doctors can give you treatment for the cancer early when it is small and easy to treat. This lowers your risk of dying from breast cancer. Many people are scared of getting tested for cancer, and that is understandable. However, many cancers, including breast cancer, are very treatable when they are found early. Starting at age 40, you should get a mammogram every year, even if you have not noticed any changes or pain in your breasts. If you do notice changes in your breasts, tell your doctor or primary care provider. They might recommend that you get a mammogram, even if you are not yet 40 years old. You may need to get a mammogram before age 40 if you have close family members who have had cancer. Tell your doctor about anyone in your family who has had cancer. Ask your doctor or primary care provider for help scheduling a mammogram. They will order the test for you, and then the hospital will call you to schedule your appointment. Try to schedule your mammogram to happen about 1 to 2 weeks after your menstrual period ends, so that your breasts are less tender. On the day of your mammogram, you should wash under your arms and wash your breasts. Do not use deodorants, perfumes, lotions, or powders that day. Wear clothes that you can change in and out of easily. Do not wear any necklaces. When you arrive at Brattleboro Memorial Hospital for your mammogram, you can park in the main parking lot or get off the bus at the main hospital entrance, then walk to the Richards building. When you enter the building, walk to the reception desk and say interpreter and then your language. The staff person will call an interpreter on the iPad for you. You will need to give your name and birth date. You can show your ID if that is easiest. You will carry the iPad with you and take the elevator to floor 2. When you get out of the elevator, turn to your left and walk to the check-in desk. You will need to give your name and birth date again. Then you will fill out some forms. If you cannot read and write in English, ask a staff person to help you fill out the forms. You can use the interpreter on the iPad to give the information needed. Then a staff person will take you to the private changing room. You will take off all your clothes and your bra from the waist up and change into a gown that ties at the front. You can keep on your clothing from the waist down. You will wait in the waiting room with others who are also getting a mammogram until someone comes to get you for the mammogram. You can have someone with you while you wait, but they cannot come into the mammogram room with you. The person performing the mammogram will be a woman. You will stand in front of the X-ray machine. One at a time, the medical provider will place each breast between 2 flat plates. These will press down on your breast. This will feel uncomfortable for a few seconds. Try to relax. The medical provider will ask you to stay still and to take a deep breath and hold it while each X-ray is taken. X-rays will be taken from different angles of each breast. The process will last about 10 minutes. When you are done, you will go back to your changing room, put on your clothes, and leave the hospital. In the days after the test, a doctor will examine the X-rays and send the results to your primary care provider. If any of the X-rays are not clear, you may need to redo parts of the test. Ask the person who does your mammogram when your results will be ready and how to learn about them. Mammograms are an important way that you can take care of your health. Getting a mammogram can save your life.